So I think I've done a lot of talking there. Let's take a little 5-minute break here. Okay, so I've got 18 minutes past 3. We're going to be talking about how to use CKS effectively. I would like, I think we've had one volunteer. Another hand, please, would be really, really good. We're going to be doing 2 cases. So I'm going to go through how to use CKS effectively, and then we're going to have case practice. I'm going to take a quick break here, 7 minutes. Okay. So we'll start for 25 minutes past 3. Okay. Thank you all. Hope that's been useful. Also forgot to mention my presentation is in that little material section at the top there. So if you want to download that, that's great. Go ahead. All right. So see you all shortly. 25 minutes past. Hello, everyone. We're just going to get started again. So just before I move on to this next bit, just a little bit of appeal, if you don't mind. So obviously, our webinars are tailored towards registrars. But I want you to please try and get as many fully qualified GPs and trainers involved with this project, okay? I'm looking for more and more speakers. I want to be talking to people. I have some excellent colleagues who want to get involved. I'm just not finding the time to do it. I also find that not very many of my fully qualified GPs are coming to my webinars and practicing and trying. And I find a lot of my colleagues are quite unsatisfied with the work they do. They're not happy, and yet they struggle to stay up to date with stuff. And projects like this, including teaching on a regular basis, it doesn't have to be an hour-long lecture. It can just be 5 minutes. It can just be an opinion. It can just be sharing a case. It can just be sharing something that's gone wrong. Encourage your colleagues to come watch these webinars. Watch it with them. Watch it with somebody who's a totally different level to you. Maybe it's a medical student. Maybe it's a trainee. Maybe it's somebody close to retirement. Discuss these webinars with them, discuss these cases information with them, because you will learn so much from their perspective, what they've learned over years distilled. There's no substitute for experience in medicine. So please try and do that with all your colleagues and encourage them to come to my sessions, because I feel this is an effective way to improve all our standards. Okay, everyone from my best friends to my wife have stopped attending my webinars, and I think they can all benefit from it. So please encourage all your colleagues to please attend our webinars. That's the first appeal I want to ask. The second one is I've been in touch with Royal College about the work I do. I've been doing this for 3.5 years now. We've got over 3,000 GP trainees on our mailing list. We've had 3 academic publications from our peer support. We've had tens of thousands of messages being shared and thousands of cases, medical cases. All of this wealth of information is so important. We need to be talking to each other. But no one is approaching me to formalize this with the Royal College just yet. I've had meetings with people, and yet everyone is just so busy, and there's so many senior colleagues who are driving these sort of projects, that people like me who are new to the fray, who have a new way of thinking, a new approach, because we have learned from you senior guys who are doing the same stuff day in and day out, decade after decade, you're not giving us a chance. You're not giving us a chance. So any of you guys that know the powers that be want to fund me to teach people and roll it out en masse, I'm ready and willing to do it. So please give us the time, give us the opportunities, because that's how our communities get better. All right, guys. So we're going to talk about NICKS and how to use it effectively. Again, I'd like to thank my colleagues on Resilient GP who prompted me to think about sharing this. But I have included stuff like this before in other previous webinars. So bear with me a moment, guys. All right, so let's start with chest pain. Okay,